comes the next step, new word breakdown. So let's take your word list, make sure you have taken time to study some of your word parts, and let's see if you can break down some terms. All right, the first up, abduction. Abduction. If you need to pause the video, go right ahead and pause the video, and then come to see our solution. All right, we do have a prefix here. The prefix is ab, ab, which means to go away from. The root term here is ducto, ducto, which is to lead or to carry. And our suffix here is ion, which is an action of. So our term abduction is a term of movement that means to go away from the body. So if you were to say move your entire arm and your shoulder out towards the side, that would be abduction. Let's take a look at another term. Maybe you've heard of this term before, or at least something awfully close. Osteopenia. Osteopenia. Go ahead and try to break it down on your own. Come back for the solution. Okay, in the term osteopenia, we do not have a prefix. We do have a root term osteo, which referred to the bones. And penia is the suffix, which means a deficiency. So the term osteopenia refers to a deficiency of the bones. What's happening here is that they're just becoming weaker. Okay, it's the reason you should have some calcium, just like Mom said. Try one more. Kyphosis. Kyphosis is the pronunciation of that. So go ahead and pause the video, try to break it down yourself, see if you can do it. All right, in the term kyphosis, there is no prefix. The root term kypho refers to a hump, and the suffix osis is a condition of. So kyphosis is a condition or an abnormal condition of having a hump. So when you see older folks and they're bent over quite a bit and that middle of their back, okay, is quite pronounced, it should have a small curve to it, but when it's very pronounced, we refer to that as kyphosis. All right, let's keep going. Practice makes perfect. Craniectomy. Craniectomy. See if you can break down this term and tell me what it means. Okay, so the term craniectomy does not have a prefix. It does have a root term cranio, and according to your word list, that means skull. The suffix here is ectomy, which is a surgical removal. So the term craniectomy refers to a surgical removal of the skull, and they're generally not removing the entire skull because that would seem like quite a bit to remove from the top and side of your head. However, they may be removing just a portion of the skull. If the brain swelling gets so bad sometimes, you've got some brain damage. In order to allow it more room, they may remove a portion of the skull. All right, let's give one more a go. The deltoid. The deltoid. This is a muscle, but let's officially break down the term. And again, if you need to pause any of these videos to give yourself more time, please do so. Okay, so in the term deltoid, there is no prefix. The root term delto referred to being a triangular shape. And the suffix oid means resembling. So the deltoid really just resembles a triangle. And if you go back to watch our previous muscular video in this same unit, it does look very wide at the top and comes down to a point at the bottom, which is a triangle shape. All right, we got some more. Arthritis. Arthritis. Okay, in the term arthritis, there is no prefix. The root term is arthro, which refers to the joints, so something that moves. And hopefully you remember itis as a suffix we've seen in most of our units refers to inflammation. So arthritis is simply the inflammation of a joint. There could be a lot of reasons for it, but arthritis is just defined as the inflammation of a joint. How are you doing on your word breakdown? Remember that practice makes perfect, and to keep going over these words, the different things that we're throwing at you, because the more you do, the easier it gets.